Hello, I'm Dr. Karthika Reddy Byreddy, Consultant Obstetrician, Gynaecologist and Laparoscopic Surgeon, Yashoda Hospitals, Secunderabad. So today we'll discuss few frequently asked questions about PCOD. So what is PCOS or PCOD? So PCOD is the condition where the ovaries released immature or partially mature eggs which turn into cysts over time. So these cysts causes enlargement of the ovaries, which in turn causes hormonal imbalances. But PCOS is a syndrome which is more severe than PCOD. It not only affects the ovaries but also causes significant hormonal imbalances, causing a range of symptoms which significantly impact the metabolic health and also fertility. So what are the common symptoms of PCOS? PCOS may cause menstrual cycle changes, that is irregular cycles and sometimes missed cycles too. And bleeding can be heavy, that is menorrhagia, and for few people bleeding can be very scanty, that is oligomenorrhea. And there can be skin related changes, that as acne, and also increased facial and body hair, especially on chest, back, stomach. There can be darkening of the skin, especially in the armpits, neck and groin. And a few people experience thinning of the hair and also experience male pattern baldness. Fertility is also a main concern where people find difficult to conceive. People with PCOS can experience metabolic issues such as insulin resistance and obesity. What causes PCOS? The exact cause of PCOS is unknown. There is evidence that genetics plays a role in PCOS. Several other factors, most importantly, obesity also plays a role in PCOS. High levels of male hormones called androgens, these prevent the egg from releasing from the ovary, which in turn causes anovulation, causing this fluid-filled sacs in the ovaries. Excess androgens causes acne and also extra facial growth in the females. Insulin resistance is another cause of PCOS. An increase in the insulin level causes your ovaries to make and release the male hormones called androgens. These male hormones suppress ovulation, in turn causing the symptoms of PCOS. So what is insulin resistance? In insulin resistance, the body cannot process insulin correctly, leading to the increased level of glucose in the body. And an elevated insulin level, even if the blood glucose level is normal, can indicate insulin resistance. And people with the PCOS tend to have chronic low-grade inflammation. How is PCO diagnosed? There is no single specific test to diagnose PCOS. Your gynecologist may ask about the menstrual history and any of the weight-related changes recently. A physical examination is must to look for acne and extra growth, hair growth, and also insulin resistance in the body. Pelvic examination is must to look for any extra growth or masses on the reproductive organs. Blood tests are also done to look for the hormone levels in the body, and ultrasound is necessary to look for ovarian PCO pattern in the ovaries. Can PCO affect fertility? Yes, PCO can affect fertility, but having PCO doesn't mean that you can't get pregnant. PCO is one of the most common and treatable causes of infertility. In women with PCO, due to the hormonal imbalances, ovulation is inhibited. So if you don't ovulate, you won't get pregnant. So as a gynecologist, we help you evaluate the concern and also give certain medication which helps with the ovulation. What are the treatment options for PCOS? Some symptoms of PCOS can be reduced through the lifestyle changes. That is, having proper, regular, healthy diet with good exercise regime, and also avoiding stress and having good sleep. And birth control pills can help to regularize your menstrual cycles and reduce all these symptoms. Other medicines are also present to reduce the acne and also extra facial growth. Laser hair treatment can also be done. And treatment for fertility of PCOS include lifestyle changes, sometimes medications, and surgery might also help you to induce ovulation. Is PCO a common condition? Some studies also suggest that 1 in 5 Indian women may experience this condition. Around 5 to 18% of the women worldwide are affected by PCOS, and in them almost 70% are undiagnosed. Women of all races and ethnicities are at the risk of PCOS. Your risk of PCOS increases if you're obese, or sometimes if your relatives like mom, aunt, sister also have PCOS.